So I was in my office last week working on some content for YouTube, and I get a call and I see that it's from my midwife. So I answer my phone and she says right away, "Did you see your test results up online yet?" And I was like, "Test results? When did I even take a test?" It was the first prenatal visit. Like, we didn't even do anything really. And I remembered, oh yeah, they took a urine sample. And then my next thought was, uh-oh, this isn't good. She told me at the appointment if I didn't hear anything that no news was good news. So obviously whatever she's going to tell me is some not so good news. So I was like, no, I haven't seen it yet. And she tells me that I actually was GBS positive. And immediately I'm feeling crushed and devastated, thinking, I'm not going to be able to have my home birth that I've been dreaming of. This really sucks. Hey everybody, welcome back to my channel. If you happen to be new here, just stopping by because you're like, yes, I'm in this GBS situation and I need to know what you did, that's perfect. My name is Dr. Nicole. I am a pelvic floor specialist. I'm also a pelvic floor physical therapist. They're kind of the same thing. And I love working with moms during pregnancy and postpartum. And I'm on my own pregnancy journey right now. And so I had my first prenatal visit last week and I was GBS positive. And if you're thinking, I don't actually even know what that means, let's back up and talk about that first. GBS positive means you have this group B strep bacteria, or I think it's group beta strep bacteria, in your urine. And surprisingly, actually 1 in 4 women will actually test positive for group B strep during their pregnancy. But for most of us, there's really no symptoms at all. The reason I'm concerned about it is because there is a chance, because this bacteria lives in my urogenital tract and because my baby will be born through my vagina, hopefully, that I could pass this bacteria to my baby. In fact, there's a 1 in 200 chance that if it's untreated, that I would pass this bacteria to my baby. And it might not be a problem at all for baby, but it could cause pretty serious things like sepsis, pneumonia, meningitis, and that's on the really serious end. Immediately, my next question was, what does this mean for my home birth? What does this mean for the safety of my baby? What does this mean for me and my imagined birth plan? I know from working in the birth space for long enough and having friends in this exact same situation that typically what they want you to do is get to the hospital at least 4 hours before you deliver your baby. So that means laboring at home, waiting to the last minute to get to the hospital is just out of the question. They want you to get this IV antibiotic into your body so that the risk goes from a 1 in 200 chance of baby getting GBS to a 1 in 4,000 chance of you passing GBS to your baby during the birthing process. And I wasn't sure if this was something that my midwives could accommodate at home, but my midwife assured me that here in Michigan, they are able to give me this IV antibiotic and I can do it at home. And we can continue on this plan for a home birth as planned. And I am so excited because I just have had such a great home birth experience and a not so great hospital experience that I was feeling really, really devastated and crushed if this wasn't going to be a possibility. So just a huge weight was lifted off of me once I realized we could still carry on with that plan. Then after I got off the phone, I was thinking, okay, what if the midwife doesn't get there in time? What, like with my last birth with my son Zay, she got there about 2.5 hours before we delivered my son. And I really like it this way. I like to labor at home alone. I feel like I can just be totally comfortable myself. I don't feel pressure like they're waiting for me to have a baby, even though they're not like that. But that's just kind of a personal pressure I put on myself, and I just like to labor at home with my husband. What about antibiotics in general? I know that I don't like to take them myself. I don't really want my children to have them because there are just some negative effects of putting antibiotics in your body unnecessarily. They definitely have their place, but they're oftentimes overused and then they cause other problems in our body. And so all these questions were running through my mind. So I started doing some research and I was like, this is perfect because I can share this with people that are in the same predicament and aren't sure what they should do. So the first thing is that not every country, I believe it's the UK actually, and then there's some places in the US and some providers that they don't actually just automatically give you antibiotics if they can do it 4 hours before your baby's born. In fact, what they will do instead is they will monitor mom. They'll say, okay, is mom's temperature above 100.4 during the laboring process? Has mom had a baby that actually had early onset GBS and got really sick after delivery because of GBS? They also are looking at, okay, how long ago did mom's water break? If it's been less than 18 hours, then that's a good thing. If it's been more than 18 hours, then they would put you in a higher risk category. And then they're also considering if you're in preterm labor. So if you're having your baby before 37 weeks, this would be another thing that would make you higher risk, I guess, and maybe have them lean towards giving the antibiotic. But if all those answers are no, 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 then they would pass on the antibiotic, and instead they would just monitor your baby very closely for those first 12 hours after your baby is born. They're looking for difficulty breathing, difficulty eating, are they acting really lethargic, do they have a fever, and things like that. And then if they have any of those things, they're going to check and monitor and take care of what could be early onset GBS symptoms. My midwife assured me that if she doesn't get there in time, she feels very comfortable monitoring my baby very closely, and I should not be concerned if they don't get there 4 hours and be able to give me the antibiotic, which was like, whew, another thing I'm really, really happy about. Sorry to interrupt the flow here, but I wanted to take a minute to say, if you're finding this video helpful, you like it, you're learning something, if you would hit that like button, it would really, really help me out. Thank you. So knowing that I'm probably gonna have the choice to call my midwife well in advance of delivering my baby, or waiting until the last minute to call her, I really have to consider, do I wanna have these antibiotics in my body before I deliver my baby? Because it's true that having this antibiotic takes my risk of passing it to baby from 1 in 200 to 1 in 4,000, and I definitely want to make sure that my baby is safe. The thing is, there are some other things that I can be doing to try to reduce the risk of passing that to my baby, and some reasons that I am concerned about antibiotics. So the reason that I'm concerned about antibiotics is that we know that antibiotics affect gut flora, and for me, but also for my baby. There actually have been studies done that showed that baby's gut flora was affected, and they were actually more at risk for illness and infection and things during their first few months of life if they did get antibiotics during the birthing process compared to babies that weren't exposed to the antibiotic. Most of them returned to normal or matched the kids that didn't have exposure to antibiotics by 1 year old, but still, they're very fragile and precious during those first few months. So if there are things I can do to reduce the risk of them getting sick, like, I definitely am all for that. The other reason I'm not a huge fan of antibiotics for a very little baby is that it actually was shown in research to cause more yeast infections between mom and baby. So when we think of yeast infections, we usually think of vaginas, but the truth is yeast infections can be passed from breast and nipple to baby's mouth. A lot of times this is called thrush, but it's actually a yeast infection. And it makes it painful for mom to breastfeed, and it makes it painful for baby to eat, and it can definitely affect the breastfeeding relationship, which if you've breastfed before, you know it is really, really challenging to have a good relationship with breastfeeding no matter what. So having this extra challenge is definitely not something I want to do if at all possible. The other thing that I learned in my research is that there are ways I can improve my gut flora, which is kind of where this whole problem originated in the first place. And that's by eating lots of fermented foods like sauerkraut and yogurt and kombucha and all that kind of stuff. Also just making sure I'm staying as healthy as possible, reducing my sugar intake because bacteria love sugar, that's what it lives off of, and so if I can reduce my sugar intake, it gives it less to thrive off of. So there are things I can do to try to make sure I test negative as we get closer to delivering baby. Unfortunately, my midwife told me that in their practice, once someone tests positive for GBS, they will basically consider you group B strep positive your whole pregnancy, and they will plan to treat you if at all possible. So even if I do test negative later on, they're still going to ideally want to give me the IV antibiotic. But if I test negative, I don't know, I think I might just feel better knowing that I have kind of solved the root of the problem by taking care of my gut flora. And the other thing that I can do to try to reduce the risk if I decide not to have the antibiotics or there just isn't time is consider a water birth, which is something I've been considering anyway. So I'm kind of like, oh, this makes me even more interested in it. So if you're my water birth people, you need to write in the comments if you had a good experience, a bad experience, and if you recommend it, why or why not. But the thing is, with water birth, there was actually a study done that showed out of 4,432 or something like that, water births, low risk water births, only one of those babies actually had early onset GBS. 1 out of over 4,000. That's what the risk is if you use the antibiotic. So this study is definitely leading to the idea that having a water birth could further reduce the risk of me passing this bacteria to my baby during the birthing process. So now I know one of my assignments is to definitely try to clean up my gut flora and get rid of this nasty bacteria lingering around in there. I am going to be seriously considering a water birth for multiple reasons now, and lowering my risk of group B strep is definitely one of them. And I can rest easy knowing that home birth is definitely still a good possibility for me. Now, there are definitely things that could come up down the road, but for now, a home birth is still a go for me, which is really, really exciting. If you want to know why I decided to have a home birth, I'm going to point you to this video next. Otherwise, thanks so much for watching today, and I will see you all in the next video.